really worldwide, there's a push to see people with suspected first seizure as soon as possible. In the UK, there are NICE guidelines which ask us to try to see these people within 2 weeks. The idea of setting it up has been to try and increase capacity, get people seen much more quickly. But we were a little more ambitious than that in the fact that we also wanted to try and make this a one-stop service. So people will come through, they'll have their EEG, which will be reported within the clinic. So they should go back with at least some rudimentary test results. Most people have to come back for their MRI, but they will have seen me, and if we feel that it's likely that they've had more than one seizure, then they'll go with medication. We'll have a discussion about that anyway. In terms of one of these first seizure clinics being run by a nurse, that is, I wouldn't say completely unique, but certainly it's not routine in the UK, and UK nursing probably takes more responsibility in the management of epilepsy than nurses in many other countries. So it's worth just 30 seconds on what a consultant nurse is, because it's a very specifically very specific role in the UK. So 50% of my time is clinical, and that's expert clinical, sort of working with people with highly refractory seizures, people with comorbidities, particularly intellectual disability, and also the first seizure assessments. And then the other half of my time is academic and involved in research. With another hat on, I'm also honorary lecturer at the University of Wolverhampton. We are currently just opening, or I am just opening, a trial called Pristine, which is using artificial intelligence to look at otherwise non-contributory EEG in a first seizure setting. So I think that will be extremely interesting. In terms of sort of headline results, not surprisingly, most people who come through the first seizure clinic have either had an isolated seizure or it's not epilepsy. We're seeing quite a number of people with psychologically based seizures, non-epileptic attack disorder, and quite a number presenting for the first time. So we've seen probably around 10% or so of our first seizure referrals have had psychologically based seizures. And then there's the kind of usual mixture, as I say, a lot of isolated seizures, provoked seizures, particularly by alcohol, this kind of thing.